This segment of DelmarvaLife is brought to you by TidalHealth.
You know, there's a funny thing about getting older. You wake up and your bones just hurt.
Oh, your hips, your knees, your joints, they all hurt. So today we're getting some insight on that pain and what you can do about it. And we're doing it with help from Dr. William Doran with TidalHealth Orthopedics. He joins us this afternoon. Thank you for being here.
It is our pleasure. It's my pleasure.
Yeah, and you brought some joints with you.
Models, yes.
Models, indeed. Okay, so it's true, you know, we do, as we get older, have those aches and pains in our joints, but at what point do you need to just go see a doctor?
So it's important to maximize all conservative measures, but if you're not getting better with anti-inflammatory medications or the information that you've been provided by your primary care physician, that's a good time when you can see an orthopedic surgeon, and we can sometimes provide additional conservative measures with injections and give further instruction with physical therapy. Ultimately, if you're not seeing satisfaction, there are other alternatives, and that can involve a joint replacement, which can alleviate some of the pain and symptoms that you're feeling.
Well, it will improve your quality of life.
It's a question I'm asked every day, and the patients, when they return back satisfied with the ability that they can walk, they can sleep, they can do exercise and activities that they had previously lost. Yeah. That's a huge satisfaction for myself to see people's lives returning to what they want it to be.
Yeah. Now you do robotic surgery.
I do
think
robotic surgery.
More than pretty much anybody else on the peninsula.
I have, yes.
How does that, I feel silly asking this question, how does that differ from opening up, going in, doing what you got to do?
Without sounding too barbaric, previous instrumentation that I would use would require putting a rod into the femur and into the tibia to obtain appropriate alignment, which creates a large hole, and it's pretty invasive. Yeah. On the alternative scenario with a robot, we have a 3D CAT scan that allows us to three-dimensionally visualize the bone, and we can template the appropriate size implant that will fit onto the bone, and without having to make that large hole inside the bone. So that's,
because my knee's not going to fit Lisa.
No, it will not. It won't. And so that's actually a really good point. You know, we're able to prepare prior to surgery to make sure that we have all the appropriate implants that will fit for you before ever an incision is made, which is good. But yes, it's substantially less invasive in that aspect. And then the technology that's inside the robot capacity has protective natures, which allow you to not have to make as big of a dissection to look on the back side of the bone, right? Because we create basically a barrier that the robot can't go beyond, and therefore you don't have to dissect to protect it because it can't actually get there anyway.
Yeah.
All right. So you specialize in anterior hip replacement.
I do.
Yeah.
Yes.
So what is recovery like for that?
So it's wonderful to see the patients immediately post-operatively. They're up within 4 hours of surgery. We have about a 70% same-day discharge rate for all comers, not just the healthiest of the healthy. Like all of our patients, our average is around 70%, and people just feel fantastic. First 2 weeks there's still going to be some soreness. I mean, you still have a bone being removed and an implant being put in, but most patients after surgery are actually saying that they feel better the same day of surgery than they did walking into the surgery.
There you go.
Right?
That's incredible.
It's a great.
Don't take this personally, but I don't want to come see you. So what can I do?
Are you sure?
No, really. No, I'm just. Is there anything I can do to take care of my joints before I have to come see you?
It's a great question, right? So, and I get asked frequently about that. One of the biggest things that anybody can do for joint preservation is watching their weight and exercise, right? So exercise is a good thing. Unfortunately, sometimes our genetics can just be against us, and sometimes you can be a very healthy person, you can be active, and the cartilage just wears away, and that's you can thank your mom and your dad for that. But when it's all said and done, yes, weight's a huge thing that you can do to decrease the stress on the joints themselves.
All right, TidalHealth's Dr. William Doran, thank you so much for coming.
My pleasure.
in.